Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and I want to welcome you to our weekly press briefing. And I'm joined today by Mayor McNamara, who has, we are estimating we're at about 61 press briefings together. It's hard to believe we've been in and responding to the pandemic for this long, and we continue. So on a positive front today, the governor announced that Phase 1B will be expanded on February 25th to include individuals with comorbidities and individuals with disabilities. I want to remind everyone that our healthcare providers continue to focus on vaccinating their enrolled populations who have had an encounter in the past 18 months. That includes Crusader Community Health, OSF Healthcare, Oak Street Health, Miles Square LP Johnson, who held their first vaccination session today, Mercy Health, and Swedish American Healthcare. The majority of vaccine has been allocated to these healthcare providers based on their enrolled patient populations. But I want to be clear that vaccine supply is currently not adequate to cover everyone who's eligible, but supplies are expected to increase in the weeks ahead, as being reported by both state and national media. Winnebago County did not receive its anticipated allocation for this week and is working with its state partners to correct that going forward. This necessitated postponing some vaccination clinics for this week. Healthcare systems are prioritizing based on age and comorbidities also, and we're reaching out to patients. We remind everyone they do not have an online registration system. They are reaching out via MyChart, so if you are a MyChart user, you might see it from there. Telephone, they may be calling you, community outreach, and email. And I remind everyone to get vaccinated at their first available opportunity and keep your appointment. That vaccine dose has been reserved for you. And if you've gotten it elsewhere, let the provider know so they can release that appointment and that dose to someone else. I want to thank our partners, including Marathon Health, Rosecrans, Winnebago County Wellness, Swedish American Better Life, who focused on vaccinating frontline workers in Phase 1B and have been helping us to catch up on Phase 1A outside of healthcare systems. This includes, we've talked about this, about the daycare workers, food processors, the first responders, grocery store workers. These were the individuals deemed essential who continue to work in person throughout the pandemic. We know that pharmacies in the regions have been allocated vaccine that has not been used through the partnership with long-term care facilities to vaccinate. Unfortunately, all have different registration systems and have different methods of bringing patients into their systems. Vaccinations of school staff have continued through the efforts of our school nurses in our county, and we should be very thankful and proud. Through their work, they have stepped up to vaccinate not only school personnel in their systems, but local law enforcement, fire departments that were not eligible under 1A, and private schools. So thanks go out to Rockford Public Schools, RPS 205, the South Beloit School System, Durand, Pecatonica, and Winnebago, who vaccinated together yesterday, and the Hononegah Nations, consisting of Hononegah, Kinnikinnick, Prairie Hill, Roscoe, Rockton, and Sherland. These groups came together and oftentimes may be competing against each other to vaccinate their community. And we are grateful for them stepping up that effort. So we also heard today that we have some positive news on the vaccination front about updated recommendations on quarantine. Vaccinated individuals with an exposure to a suspected or confirmed case of COVID are not required to quarantine if they've been 2 weeks post their vaccination after their second dose in the primary series, are within 3 months of the last dose of their series, and remain asymptomatic since exposure to the current case. But having said that, even if you've been fully vaccinated, you must continue to monitor for signs and symptoms of COVID, wear face coverings and masks, maintain social distancing of 6 feet, continue to wash your hands frequently, and stay home and isolate if you become sick at any time. So the positive side is we're seeing more and more people getting vaccinated, completing the series, which means that we can also then quarantine fewer. And this is consistent with the guidance that we use for quarantine individuals who've had what we call natural immunity, or have acquired the infection for the 3 months post. So today, reporting new cases of 25. Ages are from 7 to 80 years of age. So once again, we remind individuals, age does not exclude you. Our total case count is 26,252. Our positivity rate is 4.4%. The last time our positivity rate was this low was August 24th, at the end of the summer. And while we are pleased with our positivity rate, we continue to be vigilant. We lost 2 additional deaths to report today, and our community mourns their loss and extends our sympathy and condolences to their families. But over the last week, there have been a total of 18 additional deaths since our last press briefing. So while we look with optimism and hope with vaccination, we mourn our losses, and we need to continue to protect, because not everyone in our population has been able to get vaccinated, and it will take a while to get there. Our total death count at this point is 422. We are reporting no new locations of concern, and we extend our thanks and congratulations to the following locations so that have had 2 incubation periods without any new cases: Seaborg Terrace and Winnebago County Corrections, Winnebago County Jail. So with that, I will turn this over to Mayor McNamara.
Thank you, Dr. Martell, and thank you for your continued leadership. I don't know if my wife would be jealous or just really pleased that I'm away from the home and with you for 60 of these, but it's really been wonderful to work with you and your great team here at the Health Department. So locally, as Dr. Martell said, we are encouraged. That 4.4% positivity rate, the lowest we've had since August, is really a testament to the healthcare professionals, the frontline workers, and all citizens in our county who are continuing to take this seriously and continuing to take all the mitigations that they can personally to protect themselves, their families, and their neighbors. So a huge thank you. And obviously, all of this means that we're still making some steady progress. However, it really is a stark reminder to understand that, and I want to underscore this, 18 of our own Winnebago County residents have lost their lives too soon to this pandemic. And I think we do talk a lot about numbers at this. We talk about positivity rates, new counts, how many people are vaccinated, and we can get caught up with that. But those are 18 family members, those are 18 coworkers, those are 18 Rockfordians and Winnebago County residents that now don't have that seat at the table. And my heart goes out to each one of their families and friends as they mourn their losses. So by no means are we out of the woods as of yet. We also know this vaccination process is going too slow. Dr. Martell mentioned that we did not get our distribution allotment this week, which I think everyone would understand is unacceptable. We also know that the manufacturing and supply chains are struggling to get these vaccines out to the states and to our counties and cities. On top of this, we've seen now the new variant in our region, and I think this is the time we just have to continue to remain focused and continue to be vigilant. It's not something we say to scare individuals, it's just something that we say to make sure that we remain focused, that we're still in this global pandemic, even as things are opening up and we're starting to see some aspects of normalcy return. With that, I've mentioned it the last 2 weeks, so I'll mention it one more time this week. We know there are so many individuals out there struggling, so if you're struggling with domestic violence in your household, please reach out to the Family Peace Center. Their phone number is 779-348-7600. If you are struggling with utility bills and you are in Boone and Winnebago County, please reach out to the City of Rockford at 844-710-6919, 844-710-6919. And if you're struggling with rent, mortgage, or your water bill, we have assistance for you, and you can reach us at 844-710-6919. Also want to make note, City of Rockford has a residential roof program that we have funding for. We can assist single-family owner-occupied homes based on income eligibility for up to $30,000 of assistance with roof repairs or replacement. That application deadline is this Friday, February 12th. So please visit the City of Rockford's website, which is rockfordil.gov, or you can simply call our Neighborhood Development Department at 779-348-7162. 779-348-7162. And as we've said probably at all of these 60-odd press briefings, be vigilant, remain focused, wash your hands, wear your face mask, practice social distancing, and make sure you're checking on your neighbors. Make sure that they're all doing okay and have the services and their needs met. Obviously, the more we stay together while we stay socially distanced, we certainly will get through this together. And with that,